I've had times where I've been stressed so much by work that I've become physically ill.
I've tried to ration the food that we've been given because I'm not really sure how I'm going to be able to afford my next shop at the moment.
I didn't feel confident enough to say, it's obviously racism.
3 nurses, 3 stories, 3 different reasons to question what is going on in the NHS. Naomi Gordon is a young intensive care nurse. She has 5 years' experience, all of it a financial hardship. And she's not alone. In an exclusive survey, 2/3 of nurses said they have to work overtime to pay the bills, and a stark 39% admitted missing meals to feed their families or save money.
I'm using a food bank, a really good Christian organisation. I've now taken out credit cards. I don't usually have credit cards because I just work overtime to pay my bills, but obviously I'm not sure how I'm going to get through December. I'm not sure how I'm going to get through January.
Naomi caught COVID during the first wave and has barely worked since. If anything, she says the virus has shone a light on poor pay.
And if we are not able to look after ourselves, if we are not being cared about, how are we expected to care for other people?
160 miles away, Sahala Musa sympathises. Only in nursing for 3 years, and she's ready to leave. 30% of those asked said they plan to leave the profession in the next 12 months. 11% said this was because of poor mental health.
I had a couple of panic attacks. It gets to a point where one has to choose their sort of physical and mental well-being. I love working in A&E. I couldn't change that. But if I were to get a better opportunity abroad, I wouldn't say no for a better life.
Rachel Ambrose doesn't want to leave the NHS, but her experience of racial discrimination has made her want to change it. Around 2/3 of nurses from Black, Asian or other ethnic minority groups said they had experienced racism and discrimination, and 60% said they'd experienced bullying from colleagues. Rachel thinks she was paid less than a white colleague because of her ethnicity.
And I just remember feeling obviously really annoyed that had happened, but I think overwhelming the sense of kind of shame. I felt really ashamed that the people that I was working for didn't see that I was worth as much as my friend.
The well-being and pay of staff is at the forefront of the NHS, the government says. It's quite clear, though, few are feeling it. Emily Morgan, ITV News.